Were surprised back at the end of March when our Congressman Mike Rogers decided not to run. I'm currently a state representative. I'm in my third term in the legislature. Our country is in serious trouble. You know, we have even a Republican Party that really needs to start acting like a Republican Party. We have got serious issues, and with the debt and deficit, we continue to heap the debt on our kids and grandkids. I think it's unconscionable. The idea of that this country, and even my own party in Washington, continues to just window dress. They pretend that they're going to address the debt, but they end up with budgets that start dealing with it 10 years down the road. It's just window dressing, and they're just going through theater. And we need people that'll go there, like myself, who's not there for power. As a matter of fact, I'm going to get power out of Washington. It has way too much power. It's centralized. Whether we're talking about welfare, health care, education, land management, environmental policy, labor policy, these things need to go down to the state. If a state wants to try Romney Care, which was up in Massachusetts, let them try that. But I think that they will pay a price. Businesses and citizens will leave and go to other states. And that's something that's been a beauty of our country, is that really there's a competition between states. And if you regulate too much, people leave. If you tax too much, people leave. And so there's that healthy competition. And the more we have a more powerful federal government, the less that occurs, and they become just the central planners. The debt and deficit, the centralization of power, and particularly education, is something that I care a lot about and have fought against Common Core and the nationalization of our education system. Obamacare, we're going to hear in just a few minutes from a good friend of mine, Dr. David Hollett from the Rochester area, who is going to talk to you, and I think many of you are here for that. Doc, know that you're a wonderful guy who practiced for a time in Canada, and I guess you could talk a little bit about that. What you saw and what you're seeing as Obamacare is rolling out. With that, Dr. David Hollett. Okay, thank you.
I think most people can hear me just like this. As I said, my name's Dave Hollett. I'm a family doctor in Rochester, and I've been there for over 30 years. I'm Canadian, though, by birth, born in Nova Scotia, and my father was in the armed forces, and we moved frequently. By the age of 15, we actually moved here to Rochester, and this was the 12th place I'd lived. My dad at that point got out of the armed forces and was working for Ford Motor Company. But ultimately I went to McGill University in Montreal, did my medical school training there, worked in Canada for 3 years, and then came down here. A good friend of mine, Dr. Kresge, needed a doctor to work with him because one of his partners had just retired, Dr. Rusink. And I told him I'd work with him for a year or two and then I was going to move on, but I loved it so much I ended up staying. But the difference between what I saw in the States and what I saw in Canada was amazing. And unfortunately, the American system is now switching to the Canadian system. When I was working in Canada, we were expected as family doctors to see about 60 to 70 people a day. And that's in an 8-hour day. So you're talking 6-7 minutes per person, sometimes 4 minutes per person. In most of our examining rooms, we didn't have a chair, because if someone sat down, it took them too long to get out of the room and get the next person in. I mean, it was bing, 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 bing. There was no preventative medicine. And with all the training I went through, there was literally zero time to talk about diet, healthcare, exercising, stop smoking, or anything like that. We had one sad situation where I had a 42-year-old guy come in. He had been out shoveling snow in the middle of the winter. Felt some sharp crushing chest pain go into his left arm. And after about 2-3 minutes, he stopped, went inside, pain went away, went out there shoveling again, sharp crushing chest pain. You know, he stopped, went inside, told his wife. She says, "You better go see the doctor." So he came in to see me, and 42 years old, it's awfully young. But his dad had died of a heart attack at 48. And his brother had had a heart attack at 46. I said, "Listen, I know you're having heart problems, but the cardiologist won't see you unless your EKG is bad," and his was normal because he hadn't yet had a heart attack, "or you fail the stress test." So I said, "You got to get a stress test done. Don't do any exercise. Don't shovel any snow until you get the stress test done." Well, the waiting list in Canada was 6 weeks long. Well, 4 weeks after I saw him, we had a massive snowstorm. He goes out, shovels the snow, And he's out there for a long time. His wife looks out the window, and he's there lying in the snow face down. And he dies, and I talked to the local doctors. I said, gee, am I going to be in trouble as a physician? They said, you gave him the slip, right? I said, not a problem. Even if they sue you, the judge throws it out of court because it's all the government. The government owns everything, the health care in Canada. And in my area in Rochester, there are probably 40 stress test machines within 5 miles. In Rochester, Auburn Hills, Rochester Hills area, maybe it's 200,000 people. Where I was working in Canada at that time, Peterborough was about 250,000 people. We only had 6 stress test machines. That's all the government let us have. They only worked Monday to Friday, 9 to 5, 1 hour break at lunch, half-hour break morning, and half-hour break in the afternoon. It's a 6-week wait. I mean, in Canada right now, if you need a hip replacement, it's about 1.5 years wait. That's after you get your name on the list. There are some tests, and sadly, my dad's doing okay now, but he came down with multiple myeloma, which is a type of leukemia. He's there. My parents are living up in Canada still. He's 84 years old. He went into the local doctor, and they said, "You're too old. We can't give you any treatment at all." And fortunately, he had worked for almost 20 years here in the States, so he had full Medicare. He came down here, got the testing done. They said, "Absolutely, we trust you." And he went on chemotherapy for a year. He's now cancer-free related to multiple myeloma. But they would not treat him in Canada. A couple years after that, he came down with mouth cancer. Same thing, went in. They said, "I'm sorry, we're not going to give you any treatments other than when it eats through the side of your face, we'll give you radiation to shrink it down." Well, once again, he came down here. They said, "No, we'll put you on chemotherapy for 4 months." It's now gone. It's been 2 years and no evidence of that at all. You just do not get treatment under the socialized system because the government runs healthcare. And the main thing the government's worried about with healthcare is finances. When you have the American system, where you have independent companies, the government works as a watchdog and makes sure the companies give you healthcare. If Blue Cross is not giving you good healthcare, the government will fine them. If Aetna doesn't do the right job of access, the government will fine them. The government is the watchdog. But when the government runs everything, there are no watchdogs. I'll request someone have a prescription, and I can always argue with Blue Cross and Aetna and Cigna. 99% of the time I get them to approve because there is a protocol. They said, if medicine A and B doesn't work, it's perfectly correct to prescribe medicine C. But as trying to get things through the government, through Medicare right now, or I have many patients who are covered by the VA, it's actually terrible coverage. Now, the thing I talk about when we talk about health care, people will say, well, the Affordable Care Act will do all these great things. Well, the Affordable Care Act was 1,600 pages. As Obamacare currently stands, it's now 30,000 pages. There is no correlation between Obamacare and the Affordable Care Act. The Affordable Care Act disappeared a long time ago. So when people try to talk to me and say, "Oh, you can't call the Affordable Care Act Obamacare," I said, "Yes, I can, because Obamacare is what is existing nowadays." You've heard the promise that President Obama said, if you like your insurance, you'll be able to keep it. And we all know that that's not the case. You've heard him say, if you like your doctor, you'll be able to keep him. And then many of my patients have had to leave to go to other doctors. They say, if you like your hospital, you'll be able to keep it. And all the hospitals are being told you have to break up into certain groups, and people will sign up with certain hospitals. There are many families where the wife wants to go to Beaumont and the husband wants to go to Crittenden. You're legally allowed to do that. But in the future, you may be assigned to the McLaren hospital system. McLaren's very good, but that's the only place you'll be able to go. And if you do go to Crittenden, you will have zero insurance coverage. It has to be at the hospital you sign up with, except for life and death emergency. And a third-degree burn on half your body is not life and death. You're supposed to be able to go to the right place. Okay. When it first came out with Obamacare, they basically said it's going to cost $1 trillion. And they see it's going to save so much money. Well, within 2 years, they said, well, in actual fact, it looks like it's going to cost $2 trillion. That was in 2012. And now the the government has said we are no longer going to figure out how much it costs because we just can't. There's so many rules and regulations. It is just a terrible organization. The best organization out there is competition. Having different insurance companies be able to do what they want to do, you negotiate, you look at it, and you decide what you want. And if a company's not delivering with you, you go with another company. Our personal health care, we're still paying for 3 of our kids, went from $900 a month to $2,000 a month. My daughter just recently got married, and her and her husband bought their own health care. They are paying, as a young married couple, $1,000 a month for their health care. If you're at a certain level, you may be able to get some subsidies, but the vast majority of people who work are not getting any subsidies at all. In Canada as well, there are many medications we have here in the States which are not allowed. And that's the key thing. If you go to Europe, and I've spent time in Europe, I visited with doctors in Sweden and Germany, all over. And the whole thing about the whole European healthcare system is how to save money. What things you can do, what things you can't do. In England right now, you are not allowed to have hip replacement surgery if your hip wears out. It is cheaper to get a wheelchair than a new hip. Now, if you fall and break your hip, then they replace it. But if it is just worn out and you can't walk, tough luck. You get your wheelchair and that's it. There are more and more healthcare systems, especially in Europe, where, again, cancer treatment is not permitted after the age of 65. Because after 65, they figure you're no longer contributing to society. And after all, you are not important in a socialized system. It's what happens to society. The American system is totally different. That's one of the reasons when I came to the States and lived here for a while, I loved it. America is about you as an individual. Do what you want to do. If you want to spend your time hunting up north, spend your time hunting. If you want to fish, if you want to paint, whatever you want to do, it's about you. And the healthcare system we had here in the States, and which is disappearing very quickly, was about you as an individual. Whenever anybody came in to see me, I treated them 100%. Unfortunately, with the socialized system, as a physician, you are given basically a quota. You are only allowed to send 12 people to a dermatologist in a 3-month period. So you have to figure out which 12 you're going to send. There are a lot of quotas all the way through, and if you go over your quota, they punish you financially. Okay, and the healthcare system in Canada works somewhat because there's zero favoritism. If you're a hockey player, yes, but if we count away the hockey players, and from Canada, we accept that. But the local politician, the local bank president, the local guy, he stands in line for his appointment to the doctor just like everybody around the street. America, there's a lot of favoritism. You've already seen in Obamacare how everybody working in the White House doesn't have to go along with Obamacare. Everybody working in Congress and all their employees doesn't have to go with Obamacare. Most of the big unions doesn't have to go with Obamacare. Favoritism is left and right. See, that does not happen in Canada. In Canada, it's a much more even board. So there are some aspects, and that's why the Canadian system works, and people don't get upset. My parents right now, they book 6 weeks ahead of time to see their family doctor. Now, almost everybody in my practice can see me within 2-3 days. And if they're sick, they see me that day. And I think that's like every family doctor around. You can get in 3-4 days for routine evaluations, and if you're sick, if you're throwing up, you've got a bad headache, you get in within 24 hours. Most, call at 4:30, it may be hard to get you in by 5. But I mean, you call in the morning, you'll be in that day. And I think practically every physician does. Because the thing in the American system, we have to respond to you. If you don't like us, you're not coming back. You are our judges. But in the socialized system, we respond to the government. And if we meet all the quotas of the government, and in many, like in the Great Britain system, you're assigned a doctor, and you're only allowed to change once a year. And no matter what the doctor does with you, you can't change except till the next year. So the doctor really doesn't care about you. He cares about what the government thinks. And even in the Canadian socialized system, there are so few doctors in an area, that, people, when they're lucky to get in to see a doctor, they wouldn't dare leave. But in my practice, there will be people who, if they're looking for something different, they'll just go to another doctor. And that's perfectly fine. This is probably other than church, this is probably the second time I've worn a tie in 2 years, okay? As anyone who's been to my office knows, I wear polo shirts, and actually in the summer I wear shorts probably most of the time. I'm casual, I'm laid back. I wasn't like that when I first started. Yes, I wore the tie and everything like that. But after a while, I realized people like to be casual, relaxed, laid back. And I did have some people say, Dr. Hollett, we can't come to a doctor who's not wearing a light white coat and a tie and things. I said, not a problem. I'm sorry you feel that way, but I feel so much more comfortable in 90-degree heat. Even if we got the air conditioning turned on, I like the 90-degree heat, with a polo shirt and comfortable clothing, and they would leave me. That's fine. It is a free market system, and I think that's the way it should be. Free enterprise is what makes America great. Not this crony socialism where the government decides who gets it and who doesn't. It should be up to the individual. Now, anybody have any questions about Obamacare or the Canadian system? Yes?
I heard that under Obamacare that private research, there won't be any real incentive for private research anymore.
You're absolutely true. They are cutting way, way back. One of the interesting things, and the UN is not a good word around me, hepatitis C. I talk at a lot of local high schools to the young kids about venereal disease. Rochester High School have been doing it for 15 years. I've talked up here to Lake Orion. They usually have me come in and talk to the 10th graders just before homecoming about what will happen if you do the wrong thing with the wrong person. And one of the things about 5 years ago, a disease called hepatitis C was just exploding through the United States. It'll totally rot out your liver. It's a very silent disease. You have no idea you have it until you've had it about 15 or 20 years. And suddenly you're just feeling weak and tired. You go in to see the doctor and your liver is 80% destroyed. Now, 6-7 years ago, we had no treatment. 70% of the people who would come down with it would die from it unless they got a liver transplant. Well, just recently, about 3 months ago, we got some drugs that helped and some better ones that helped, and then some better ones that helped. And now we have a drug that you take one pill a day for 90 days, and there's a 97% cure rate. You're done. And hepatitis C is out of your body. You live the rest of your life. There's nothing wrong. Now, that came out of American research. Now, the interesting thing that has come out, as we've done more and more research, there are 5 types of hepatitis C. Now, the research was all done here in the States. It was all done privately funded by a pharmaceutical company who felt, I hate to use the phrase, there was money to be made if they could come out with the right medicine. And they did the research, and they developed this pill, and it has just revolutionized everything. I mean, now if you have hepatitis C, you probably have a better prognosis than if you have a little bit of skin cancer. Okay, whereas 6-7 years ago, it was a death rate. It was a death, your only option. Well, as I was mentioning, we have type 1 here in the United States, 99% of people. In Europe, it's type 2 and 3. In Africa, it's type 4. This pill doesn't work on type 2, 3, and 4. It only works on type 1. The UN has asked the American government to force the pharmaceutical company to stop making that pill until they can develop the pill for type 2, 3, and 4. Because it's not fair that Americans would get cured by this and not the rest of people in the world. I mean, to the UN, they don't care about America, they care about the world. Okay? Yes, I love my neighbor, but you know what? The most important thing for me is my family. Outside of my family, then yes, the people around me. Outside the people around me, a little bit wider. I've climbed the Himalayas, I've been to Thailand, I've hitchhiked from Ireland to Egypt, I've seen a lot of things. I love those people, they're all great, but you start off near your home and slowly spread out. And the UN doesn't like the United States, okay? So private funding can get a lot of these miraculous cures, but the government wants to shut that down and direct who gets to have anything. We know how much money is being thrown into the the windmills and things like that. Now, unfortunately, I do have a cousin who's an engineer, and he's dedicated his whole life to windmills, this, that, and that. But the research I read on it, it's not going to make too many airplanes fly. Okay, So you're right about cutting back on private, and everything will be run through the government, and that's going to hurt us. I love the rest of the world, and I think there's not enough freedom in the rest of the world. There's not enough democracy in the rest of the world. The thing we have to spread from the United States is democracy and free enterprise. Okay, that is what we need around the world. It's not we have to send our money over there. We need to spread free enterprise, and that's where Tom stands. A lot of people in the Republican Party will talk about that, but Tom is very much a person towards smaller government, give you the the decisions and the freedom to make your decisions. And we've seen just some other primary elections in Virginia recently, where a dark horse came out of nowhere and knocked out one of the top Republicans, and that's because, and when I've heard some people call in from Virginia, many people, all they did is called every one of their friends. And that's all they did. They called 20, 30 people and said, listen, with this upcoming election, I want you to strongly think about Tom McMillin and say why. If I call and I will volunteer my time to Tom, they don't know me. I'm just the name in the other end of the phone. And we've seen from some of the flyers that Tom's competitors put out, they're labeling Tom as a high spender. Well, that's not true at all. So somebody on their phone, they get 3 phone calls and they all say different things. What happens? But if you call your friends, that makes all the difference in the world, okay? And there's enough information on this sheet that you can take home. And again, you call 10 of your friends, 10 more votes may be all it takes, okay? And but with that, any other questions? I'll turn it back to Tom.
Yeah, any other questions for Dr. Hollett as far as, how do you see this unfolding? So you've seen a little bit of Obamacare.
Yeah.
How do you, what's going to happen? If we don't repeal it, what do you see
Well,
this going?
the thing that I see, and this is what happened in Canada, in an area like this, there starts to become favoritism. And what they will probably do is they'll shut down Crittenden Hospital, and everyone will have to go to Troy Beaumont, the Royal Oak Beaumont. Now, they'll keep St. Joe's going, but they may shut down anything McLaren will have. It'll make it harder and harder to get in. In the Canadian system, they'll assign a certain number of doctors to an area. Because the only way to control costs is have fewer doctors. So in the Rochester area, we probably have about 40 family doctors. Now, I figured 20 years in socialized medicine, and they'll only let 17 be in that area. Well, if I had to run the practice of 2.5 doctors, I will be swamped. And I hate to say it, it will take people 3 weeks or 4 weeks to get in to see me. And but that's the way you save money. Cut down the doctors. Yes?
If you're on Medicare, not have to go to the hospital, you better make sure that your doctor sends you to the hospital.
Yeah.
Because if you go to emergency by yourself with no doctor authorization, Medicare will not pay for your emergency treatment.
Very much so.
I found that out personally.
And their definition of what is an appropriate ambulance ride, you may feel like you're dying, and when the EMS comes, they may think like you're dying, but when you get to the emergency room and they run some tests, they may find you just had a little bit of case of food poisoning. Well, since they know the next morning what it was, well, therefore it wasn't an emergency today, you pay the $600 ambulance bill. Well, when you're weak, shaky, lightheaded, maybe even passed out, you don't know whether you're dying or whether you make it through. And when that doesn't happen with Blue Cross and Aetna, it happens with Medicare and the government run, because they're not interested in quality, they're interested in cost control. Yes?
I just have a statement. I see the same thing happening with what's happening with the VA today is what's
Right.
going to happen to everyone, because it's the same concept coming.
Right.
Same concept.
Yeah. So I think as Tom said, what I see in the future, we're going to have fewer hospitals, fewer doctors. It'll take longer to get in. I'm a family doctor. I love family medicine. I love taking care of people. They want to get rid of all family doctors. They want to basically get all nurse practitioners, and then the nurse practitioner, you have to impress her that you're sick to get beyond step 2. And she will know, she'll have a recipe she follows through. If your elbow hurts, do this for 4 weeks. If it's not better, come on back. Even though the doctor will look at it and say, hold it, it's not a tennis elbow. There's something more serious going on. No, we can't do an x-ray until you finished up 4-week treatment. But they'll also give the nurse practitioner protection, excuse me, that you can't sue her. As long as she followed the recipe, you can't sue her. And that's what it is in Canada. The doctors have a recipe. If we follow it and you suffer, that's your tough luck, because the recipe is designed to help the most number of people for the least amount of cost. Okay? It doesn't help everyone, whereas in private enterprise, the only person I care about when I'm talking to a patient is that person in front of me. Okay? I don't think about, okay, I've had 10 people come in with severe headaches. I have only allowed to order a CAT scan on one of them. Hey, if all 10 need a CAT scan, all 10 get a CAT scan. You know, and because the care is most important to you as an individual. You know, yes, we all want America to do well. We all want America to not go bankrupt. But we start off worrying about ourselves. Okay, and that is appropriate. Okay. Any other? Yes.
I don't know if the question is for you or for Tom, but say we take over the Senate, and we, between the House and the Senate, repeal Obamacare. Obama says he would not sign it while he's in office.
Well, that's true. I think he has said we'd have to have a tumble know this perfectly, but I think to override a veto, we need 2/3 or 3/4, something like that. But there have been so many bills come forward to cut out the funding towards different aspects of Obamacare. We can slow it down dramatically and then work incredibly hard at the next election to get a conservative Republican presidential candidate in. And then when we get that candidate in
They
there,
haven't defunded it yet.
Well, and let me
Yes, that's what we're talking about.
let me jump in. The legislature has the power to stop Obamacare. We would have to have the guts to do it, the backbone to do it, and we would have to work very hard. It would require Republicans to, and I've said this, I have town halls and I have district hours. If I knew that we were going to have a vote on the budget, that's where you do it, is in the budget or the debt ceiling limit. And let me give you an example of what I'm talking about. Last year, a little over a year ago, our governor, who's done a lot of good things, was on stage with Arnie Duncan, President's education guy, and in Detroit, on TV, talking about how wonderful Common Core is, this nationalization of education. And it was very important to him. Well, 8 weeks later, the governor was signing a budget defunding Common Core. Something he had just said was critical, was on stage, very unusual with the U.S. Department Secretary of Education. Now, that doesn't happen. But I led that effort. He did it because I organized 8 of my colleagues, and we basically held the budget, not hostage, but it was not going anywhere unless it was defunded. And we were going to have a showdown.
Is it still defunded?
No. Let me. So we defunded it. He signed a budget that he didn't want to sign. And that's what you do, is you say, we forced the debate. So there was a debate that ensued over the whole summer. The nation was focused. We had national experts from both sides. In the end, I was hoping my colleagues, if they didn't understand Common Core, that they'd vote no. Many of them, even some in this area, said they didn't understand it, but they voted yes because of some big business, and some others said that we need those workers. They think that the government and the education system is there to produce workers for them, which is not true, or not the right way to think about it. Nonetheless, a legislature needs to act like a legislature. The power of the purse is what they have. They don't have a lot of other power, but if you see something the executive branch is doing wrong, that is where you say in the budget or in the continuing resolution, because Democrats don't pass budgets in the Senate. For many years they haven't, but they do pass continuing resolutions to keep the government open. That's where you do it, or the debt ceiling increase. You say, and it would take a lot of work. I would go there to Congress and say, look, for the next week, this vote is going to come 4 months from now. Every week we better be holding town halls for the next 20 weeks. Because this is going to be a tough vote, and you got to go around the media and around the liberals and go right to the people and explain to them what you're about to do. We are about don't buy that Social Security will be cut off, that Medicare will be cut off, because it's not true. Make sure that people understand the truth and say we're doing this because we want our freedom back on Obamacare, and we're going to hold out. And if the president does not sign these bills to continue funding some areas, that's his fault. We're going to send him some bills to continue funding other areas, but that's where you can do it. So legislation, yeah, you're right, it's got to get through the House, through the Senate, the president vetoes it, it comes back, vetoes it and you try to override it. It's a lot of work, but the budget is where you do these things. And so I think that I proved last year, much to the dismay of a lot of people, I mean, when we held that, we kept the budget from getting approved. There were big funding people in the Republican Party very upset at the 9 of us who were holding out, and they were calling them into governor's office and really putting a ton of pressure on them. In the weekends, I get a call on Sunday night, so and so, this guy, they just called me and said it's horrible what we're doing. But it was something important. We needed to force this debate. We needed to do whatever we could to stop the nationalization of our education system. And so in Obamacare, if we have a Republican president, one that will repeal it, and we have the House and Senate, that's fine. Maybe we can do that in a few years. But we can also fight now. It takes a lot of work, and that's something that, and you have to think outside the box. You have to say, we're going to step up, and act like legislators and do what we're supposed to be doing. But I thank you all for coming, and I certainly would appreciate your consideration for your vote on August 5th. Thank you.